Let's see occupational lung disorder. It includes pneumoconiasis, occupational asthma, and hypersensitive pneumonitis. In this section, we will talk about pneumoconiasis. Pneumoconiasis is basically accumulation of dust in lungs and tissue response to it or reaction to it. According to particle size, if more than 3 micrometer particle is present, then it will lodge in between trachea and secondary bronchi. If the particle size is 0.5 to 3 micrometer, it will lodge in bronchioles. If particle size is less than 0.5 micrometer, then it will lodge in alveoli. Examples of pneumoconiasis are silicosis, asbestosis, coal worker pneumoconiasis, and berylliosis. Bicinosis is not a part of pneumoconiasis because it comes in hypersensitive pneumonitis. In Let's see these four diseases: silicosis, asbestosis, coal worker pneumoconiasis, and berylliosis one by one. We will see like this that whether the pleura is involved, parenchyma is involved, when and malignant potential is present or not. So let's see first silicosis. In silicosis, there is no pleura involvement, and there is parenchymal involvement, and malignancy is present. And malignancy is increased in smoking. Lung parenchyma involvement is in upper lobe and fibrosis occur. The basic mechanism is that this silica attacks the pulmonary alveolar macrophages, and this releases the TB bacilli from the macrophages, so it will cause silicotuberculosis and also increase autoimmune association, that is SLE, RA, and systemic sclerosis. This silicosis also increase the risk of COPD. The form which is toxic is crystalline form, that is known as quartz. Uh, Toxic form is SiO2 or flea silica. In the sandblast, ceramic, and slate pencil rock industries, this silicosis occur. Acute silicosis. Silicosis, it occurs within 2 years of massive exposure. The features is severe dyspnea, hypoxemia, and the weight loss. In X-ray, we will find bilateral filling opacities. In CT scan, the most important finding is crazy pavement pattern. It has a triad, that is GGOs, glass ground appearance, small nodules, and thickened septa. This crazy pavement pattern is also seen in pulmonary alveolar proteinosis. Similar to pulmonary alveolar proteinosis, pus is positive and milky white bile is present. This acute silicosis has very poor prognosis. Now let's see the chronic silicosis. For chronic silicosis, the exposure should be 10 to 30 years, and the hallmark of chronic sclerosis is bilateral symmetrical upper lobe nodule is present. This nodule can combine and form conglomerate nodules. If the nodule size is more than 1 centimeter, then it can lead to progressive massive fibrosis. Hilar retinopathies with axial calcification is also seen. And nodular may undergo fibrosis. Example, upper lobe ILD. Presence of chronic cough, dry cough, and progressive dyspnea is the features. Spirometry, we see obstructive plus restrictive means mixed pattern. Clubbing is rarely seen and chest signs are 25%. Second disease is coal worker pneumoconiasis. This is also called as black lung, and it is related to the coal mining. Yes. In this, pleura is not involved, parenchyma is involved, and no malignant potential. It is very similar to silicosis in presence of large nodules, involvement of upper lobe, tendency to go towards massive fibrosis, involvement of pulmonary alveolar macrophages, and smoke association. Uh, it is different from the silicosis from 2 points, that is, it has no higher lymphadenopathy, and malignant association is not proven. Yes. In complicated coal worker pneumoconiasis, nodule of more than 1 centimeter can go to fibrosis, and cavitations are also present. Calcification and hilar retinopathy is not seen. Special syndrome is seen in coal worker pneumoconiasis is Kaplan syndrome. Kaplan syndrome is basically rheumatoid arthritis plus coal worker pneumoconiasis. In rheumatoid arthritis, seropositive active rheumatoid arthritis with synovitis, and IgA as a rheumatoid factor. In coal worker pneumoconiasis, there is a necrobiotic nodule is seen. Third is asbestosis. In asbestos, pleura, parenchyma, malignant, all three are involved. Exposure of more than 10 years is required, and it is associated with the smoking only in parenchymal and malignant cases, not in the pleural involvement. Yes. Basically, types of asbestosis, two types: serpentine, which is curly, it is seen in 90% and less toxic. Second is amphibole, which include amosite, it is brittle, long, straight rod like structure, it is most dangerous type. It is seen in textiles, cement, ship building, automobiles. Let's see the pleural findings in asbestosis. Earliest finding is the BAPE, that is benign asbestos related pleural effusion. Lower lip is involved when most of pathogenic finding is pleural plaques, that is thickening of parietal pleura and calcifications. Uh, Benign asbestos related pleural effusion is seen in young patients. It is unilateral exudative hemorrhagic and eosinophilic. Mesothelial effusion, eosinophilic is less than 25% and mesothelial is 50%. Second is pleural plaques. The calcification pattern is candle dripping pattern, holy leaf sign, table mountain calcification. And if the visceral pleura calcified, then it is known as crowfoot sign. When it's involved lung parenchyma, it involves bilateral lower lobe pathology, and here no nodules is seen, here infiltrates are seen, and higher lymphadenopathy is not seen. It progresses to diffuse massive fibrosis. Lung signs are very minimal. And third, malignancy. It is related to amphibole type, yes. For parenchymal carcinoma lungs occur, and for pleura mesothelioma occurs. ठीक है. For carcinoma of lungs, 20 to 30 years latency period, and mesothelioma more than 30 years. Carcinoma lungs, adenocarcinoma most common. Mesothelioma epithelioid types more common. Carcinoma lung associated with smoking. Mesothelioma is not associated with smoking. In mesothelioma chest pain occurs, in carcinoma lungs cough and hematosis occur. Some electromicroscopic finding of mesothelioma are pancytokeratin, calretinine, microvilli, desmosome, and tonofilament. The fourth disease is berylliosis, and the berylliosis exposure is required is more than 10, less than 10 years. It occurs in younger age group and in alloy, ceramic, and electronic industries. It only involves parenchyma. It does not involve pleura, and it does not have a malignant involvement. Here also upper lobe is involved, and it lead to fibrosis. And the clinical picture is exactly similar to sarcoidosis, having non-causating granuloma, lymphocytes in bile, but it is slightly different from sarcoidosis, that it does not involve CNS, eye, peptide manifestation, and